Currently, there are two types of tests for SARS-CoV-2, which provide different kinds of information. Diagnostic tests tell us if someone is currently infected. Antibody tests, also known as serology tests, tell us if an individual was infected in the past and has had an immune response. Serology testing does not detect the presence of the virus, but rather detects the antibodies that are or were produced by the body in fighting the disease. Antibodies are proteins produced by the immune system in response to an infection and are specific to that particular infection. They are found in the liquid part of the blood called serum or plasma. Immunoglobulin M or IgM is the first type of antibody produced in response to an infection and is detectable 4 to 7 days after an infection starts. IgM antibodies are short-lived and their existence signals a new infection is present. Immunoglobulin G or IgG antibodies are produced 7 to 14 days after infection. These antibodies can be detectable for weeks, months, and even years depending on the antigen and the individual. IgG antibodies are usually sustained for a longer time and may play a role in lasting immunity. However, since we don't know a lot about SARS-CoV-2, as it's a new virus, we don't know how immunity against this virus works. Total assays, which are combined IgG-IgM tests, cannot distinguish between early IgM and late IgG antibody responses. As a result, total assays can't reveal whether a person has the IgG antibodies that are needed for longer-term immunity or if they are currently infected. For clinicians, knowing whether an individual has developed SARS-CoV-2 specific IgG antibodies could be critical to determining immunity. An IgG-specific serology test reveals if someone had COVID-19 in the past and as a result has developed antibodies that are specific to this virus. The right type of serology test could help us understand immunity against COVID-19 at an individual and population level. This can be a key tool to help us develop plans to reopen society.